every month is definitely an awareness of some type of cancer. In this month, we're looking at cervical cancer. Next month, we'll look at gallbladder and bile duct cancer, and that goes on. So then at National Cancer Institute, what are you doing in terms of just creating more awareness about cancer, so to speak?
Thank you for having me. And as you correctly said, the National Cancer Institute is the agency within government that is mandated to coordinate all issues around cancer prevention and control. It's a state corporation established through an act of parliament, so it's basically domiciled within the Ministry of Health. And the act assigns a number of functions to the institute. One of them is actually the issues, in a very large extent, the issue of awareness creation. Okay. And we have seized that function very strongly, because we believe that that's the starting point. Mm-hmm. Kenyans need
awareness is the starting point.
Yes, that's the starting point. Kenyans need to be aware right from what is cancer, understanding how they can prevent themselves from getting cancer, because cancer is actually preventable. Mm-hmm. Understanding how they can get to know if they have cancer. Mm-hmm. And here we're talking about some cancers that can be screened, some cancers that they can have detected early. We also need Kenyans to be able to understand where services are available. So these services on prevention, these services on screening, these services on treatment, where are they available? So to a large extent, that is a big portion of what we do. Okay. So we do through creating partnerships with other agencies. So to start with, we work very closely with practitioners in the Ministry of Health, both at the national level and the county levels, because those are at the front line. Healthcare workers are actually at the front line in terms of creating awareness. But we have gone beyond the health sector. We are building partnerships with other agencies within government. Case in point, we work very closely with Huduma Kenya, so that we use the various Huduma centers across the country to create awareness. We have developed materials in various languages that are just giving a very basic understanding of what cancer is, the signs and symptoms, and where people can access treatment. Mm-hmm. We work very closely with, for example, the Media Council of Kenya. Yes. We have engaged with them, and we have had training of journalists, so that we can also use the media to also create that kind of awareness. We have worked very closely with the Ministry of Education, because we also think that the education sector is very critical in terms of passing messages to our children, but also to the teachers as well. So essentially, we worked through some of those stakeholders. We also work with the faith-based sector, civil society sectors, so that we use. I think the whole idea is to use multiple platforms to create this kind of awareness.